Think about flu season for us humans. That feeling, right? When it seems like everyone around you is coughing and sneezing. Now, try to imagine a version of that, but for an entire stable, horses, donkeys, mules. It's a very real threat in the equine world. We're talking about equine influenza, often just called horse flu. So, our mission in this deep dive is basically to unravel everything about this disease. It's highly contagious, affects the respiratory system. We've gathered a whole bunch of sources, vet guides, research papers, you name it, and we're going to pull out the key bits of knowledge for you, give you a shortcut to getting really informed.
And it's incredibly important, this topic, not just for vets or, professional riders. Really, it's for anyone involved with horses. Competitors, owners, even just enthusiasts. Equine influenza, EI, it spreads so fast. It can have a huge impact on animal health and, honestly, the whole equestrian economy. It's definitely one of the most common and economically significant diseases for horses globally.
Okay, so let's unpack this then. What is equine influenza really at its core?
Right, so basically, EI is an acute respiratory disease. It's caused by the equine influenza virus, EIV. It's part of the orthomyxoviridie family, that's the influenza A group. And the key thing right off the bat is just how incredibly contagious it is. Seriously contagious. And knowing that, it really changes how you think about stable management. It becomes all about proactive biosecurity, because any horse could potentially start an outbreak.
That makes a lot of sense. Okay, so the virus itself, EIV, are there different types, like how we have different...
Yeah, absolutely. Good question. Historically, we talk about two main subtypes. There was H7N7 or equine 1. We think that one's extinct now, thankfully.
Okay.
Haven't seen it in like over 20 years. The one circulating now, the one we really focus on, is H3N8. That's equine 2. And even within H3N8, there are these specific branches or sublineages, often called the Florida strain. You've got clade 1 mostly in the Americas and clade 2 mostly in Europe. And this kind of geographic split is exactly why vaccine makers have to constantly track what's going on where, to make sure the vaccine you use actually protects against the strains in your area.
Yes, fascinating. And you mentioned tracking changes. We hear about human flu strains changing all the time, needing new vaccines each year. Does the horse flu virus do that too?
Yes, it absolutely does. It's a process called antigenic drift.
Antigenic drift, okay.
Yeah, think of it like the virus making tiny changes to its disguise over time. Little tweaks to its surface proteins. Those are the hemagglutinin, the H, and the neuraminidase, the N. You hear H and N in flu names, right?
Right, like H3N8.
Exactly. And those small shifts mean our immune system, or the immunity from a vaccine, might not recognize the new version as well. That's precisely why we need regular updates for flu vaccines. For horses, just like for people. What worked last year might not be the best fit this year.
So this constantly adapting virus gets into a horse. What's it actually doing inside the body? What's the mechanism?
Okay, so it targets the cells lining the respiratory tract, the epithelial cells. It replicates really fast in those cells, and that causes direct damage to the lining of the trachea, the windpipe, and the bronchi, the airways in the lungs. Crucially, it damages the cilia. Those are the tiny hair-like structures that normally sweep mucus and debris out of the airways. They're like the lungs cleaning crew.
Ah, I see. So it damages the cleaning system.
Exactly. And when that system is compromised, the horse's natural defenses are way down. This makes them much, much more vulnerable to getting secondary bacterial infections. So the virus itself is bad, but the complications from that damage can be really serious too.
That's a really critical point. And understanding that vulnerability leads straight to, well, how does it spread? How does it get from horse to horse so effectively? Getting a handle on transmission seems key to stopping it.
It really is fundamental. The main way it spreads is through the air, airborne droplets. When an infected horse coughs or sneezes, these tiny virus-filled particles get aerosolized. And they can travel, believe it or not, up to 50 yards, maybe even more in the right conditions.
50 yards. Wow.
Yeah. Then there's direct contact, of course, nose-to-nose touching, and then maybe the trickiest one is indirect contact through what we call fomites.
Fomites, right. So that's like contaminated objects.
Precisely. Things like tack saddles, bridles, brushes, grooming tools, water buckets, feed tubs, even people, handlers' clothing, their hands, maybe even their vehicles if they're moving between farms.
Wow. So even if you're careful with your horse, you could accidentally spread it.
Exactly right. Stalls, trailers, they can all harbor the virus too. It turns everyday, stable life into a potential transmission zone if you're not super careful with biosecurity. What makes it spread like wildfire, though, is the really short incubation period.
How short are we talking?
Usually just 1 to 5 days. Often, it's as quick as 24 to 72 hours after exposure. And here's the kicker. horses can start shedding the virus, meaning they're contagious, before they even show obvious signs of being sick.
Oh, that's tough.
It is. They can shed for up to 7 to 10 days, maybe even 2 weeks in some cases, so it spreads rapidly before you even realize there's a problem. Geographically, it's pretty widespread. It's endemic, meaning it's commonly found in the Americas, Europe, the Middle East, Asia. Australia had a big outbreak back in 2007, their first one, but they managed to eradicate it and are currently EIV-free. New Zealand and Iceland, thankfully, have stayed clear.
Okay, so it spreads fast, sometimes silently at first. What are the signs we should be looking for? What does a horse with flu actually look like? Do they all show the same symptoms?
Well, the signs can definitely vary. Depends on the horse's age, its immune status, vaccinated versus unvaccinated, and if it's encountered the virus before. But typically, the early signs, usually popping up 1 to 5 days after they're exposed, start with a high fever.
How high?
Often between 102.5 and 106 degrees Fahrenheit, so quite high for a horse. Along with that, you'll usually see depression, lethargy, just acting really dull. They might go off their feed, so anorexia, and sometimes muscle pain or weakness.
Okay, those are the early flags. What happens as it progresses?
As it moves along, you usually see a really characteristic cough develop. It's often described as harsh and dry, like a hacking cough.
And that cough sticks around.
Oh, yeah. It can linger for quite a while, usually 2 to 3 weeks, but sometimes even up to 6 weeks after other signs have gone. Nasal discharge is common too. At first, it's usually clear and watery, sort of serious. But if, and this is common, a secondary bacterial infection sets in because of that damaged respiratory lining.
And the discharge changes.
Exactly. It becomes thicker, maybe cloudy, white, or even yellow-greenish, pus-like, basically.
Yeah.
You might also feel or see enlarged lymph nodes, particularly the ones under the jaw, the submandibular ones, and maybe in the throat latch area, the retropharyngeal ones.
Any other less common signs?
Sometimes you might see some swelling in the lower limbs, that's edema, maybe conjunctivitis, red eyes, or epiphora, which is just excessive tearing.
And you mentioned complications earlier. The secondary bacterial infections sound like a big one. What else can go wrong?
Yeah, secondary bacterial pneumonia or bronchitis is definitely the most common complication. It happens because that damaged mucociliary system just can't clear things out properly, and that really extends the recovery time. Less common, but definitely more severe, potential complications include things like chronic obstructive pulmonary disease, COPD, or what we now often call equine asthma. In rare cases, you can even see myocarditis, which is inflammation of the heart muscle, or vasculitis, inflammation of blood vessels.
Wow, heart issues too.
It's rare, but serious when it happens. And it's really important to remember that young foals are more susceptible, they're more likely to die in an outbreak, and pregnant mares, tragically, might abort their foals or deliver them stillborn. So thinking about all these signs, fever, cough, nasal discharge, this raises a really practical question for horse owners.
How do you tell it apart from other respiratory stuff?
Exactly. How do you differentiate it from, say, equine herpes virus or maybe strangles or equine viral arteritis? They can look similar sometimes, right?
That seems like a really critical distinction to make, especially for deciding what to do next.
It absolutely is. While some symptoms overlap, there are clues. Equine influenza typically spreads much faster through a group of horses than most others. That rapid onset is a big flag. Also, that harsh, dry cough is usually much more prominent, more severe with EI compared to, say, EHV. And with strangles, while you get fever and discharge, you usually see much more pronounced swelling and abscess formation in the lymph nodes, often quite painfully. So looking at the whole picture, speed of spread, type of cough, lymph node involvement helps differentiate.
Okay, so clinical signs give you strong suspicions, but given the potential for serious outcomes and how contagious it is, getting a definitive diagnosis quickly seems crucial.
Absolutely critical. Prompt, accurate diagnosis is key for biosecurity stopping the spread and for guiding treatment appropriately.
So clinical suspicion is step one. What's next? How do vets confirm it?
Right, so suspicion starts with seeing that acute onset of fever, the cough, the discharge, especially if there's a history of exposure. Maybe a new horse arrived, or the horse traveled to a show. But like we said, those signs aren't unique to EI, so you really need laboratory diagnostics to confirm it definitively.
This is where the lab tests come in. What's the best way to test, and when should you do it?
The timing is really important. You want to collect samples early in the course of the disease, ideally within the first 3 to 5 days after the fever starts. That's when the virus shedding is typically highest.
Makes sense. And what kind of samples?
For detecting the virus directly, the best samples are usually nasopharyngeal swabs. basically a long swab carefully passed up the nose to reach the back of the throat, or sometimes a nasopharyngeal wash.
And what tests do they run on those?
The preferred method nowadays is RT-PCR, reverse transcriptase polymerase chain reaction.
Okay, PCR. We hear about that a lot.
Yeah, it's incredibly useful. It directly detects the virus's genetic material, its RNA. The big pluses are that it's highly sensitive. It can detect very small amounts of virus. It's very specific for EIV, and it's fast. You can often get results back within hours, maybe the same day. And in an outbreak situation, that speed is just invaluable for getting control measures in place immediately. Knowing what you're dealing with quickly is half the battle.
Speed definitely seems paramount. Are there other ways to detect the virus itself?
There are. Virus isolation is another method. Use the same kind of sample like a swab. But instead of looking for RNA, you actually try to grow the live virus in cell cultures, or sometimes embryonated chicken eggs.
Growing the virus, why do that?
The main advantage is that it gives you a live virus isolate. This can be really important for research, for tracking viral evolution, and especially for making sure vaccines are up to date with currently circulating strains.
But it sounds slower.
It is much slower, yeah. It can take days, sometimes weeks, to get a result.
Yeah.
So not ideal for rapid diagnosis during an outbreak. Then there's something called antigen capture ELISA. These are often designed as rapid stall-side tests.
Like a quick test you can do right at the barn?
Potentially, yes. They detect viral proteins, antigens, in nasal secretions. The advantage is speed. The downside is they tend to be less sensitive than PCR. So you might get false negatives, meaning the horse has flu, but the test is negative. And usually a positive result on a rapid test would still need confirmation with PCR or virus isolation.
Okay, so those are for finding the virus itself. What about looking for the horse's immune response? Antibody tests?
Yes, serological tests detect antibodies the horse produces against the virus. The standard method here is using paired serum samples.
Paired samples, meaning you take blood twice.
Exactly. You take one blood sample early on when the horse is acutely ill, the acute sample. Then you take a second sample about 2 weeks later during the recovery phase, the convalescent sample. You measure the antibody levels in both samples, usually using tests like hemagglutination inhibition, HER, or ELISA. If you see a 4-fold or greater increase in antibody levels between the first and second sample, that's strong evidence of a recent infection.
But that takes weeks to get an answer.
Right. That's the main limitation for outbreak management. It's great for confirming infection after the fact or for surveillance studies, but not for making quick decisions. Plus, vaccination can really complicate interpreting antibody levels, as vaccinated horses will have antibodies too.
Are there any other diagnostic tools vets might use?
Sometimes, yeah. A complete blood count, CVC, or blood biochemistry, might show some changes. Early on, you might see low lymphocyte and eosinophil counts. If a secondary bacterial infection develops, you might see an increase in white blood cells, like neutrophils, that's leukocytosis. And if pneumonia is suspected as a complication, chest x-rays, radiographs, or lung ultrasound can be really helpful to visualize what's going on in the lungs.
Okay, so you've done the detective work. You've got a confirmed diagnosis of equine influenza. What's the treatment plan? Is there like a Tamiflu for horses?
That's a common question. But the reality is, unlike some human flu situations, there isn't a specific antiviral drug that's routinely effective and used for equine influenza. So, treatment really boils down to supportive care, helping the horse's body fight the virus and preventing those complications we talked about.
Supportive care, what does that actually involve? It sounds like maybe the horse does most of the work.
In a way, yes. The horse's immune system has to clear the virus. Our job is to give it the best possible chance to do that.
And our sources really emphasize one thing above all else for recovery. It sounds simple, but maybe it's not. Rest.
Absolutely fundamental rest is crucial, non-negotiable, really. The general rule of thumb, and it's a really important one for people to follow, is to give the horse at least 1 week of complete rest for every single day it had a fever.
1 week per day of fever.
Yes, and even then, there should be a minimum of 3 weeks of strict rest from any exercise, even light work, even if the horse seems bright and recovered.
Why so long, if they look better?
Because of that damage to the cilia we discussed. Remember the respiratory tract's cleaning system?
Right.
That takes a long time to heal properly. It can take a month, even 2 months, for those cilia to fully regenerate and function normally again. If you put the horse back into work too soon, you risk delaying that healing, causing potentially long-term lung damage, making them prone to recurring respiratory issues, or increasing the chance of secondary infections taking hold. It's just not worth rushing it.
Hmm.
You're trying to get them back to full health, not just looking okay.
That really drives home how important patience is. Okay, besides strict rest, what else falls under supportive care?
Environmental management is huge. First off, immediate isolation of any suspected or confirmed case. Keep them well away from healthy horses. Then, strict biosecurity. Separate equipment buckets, brushes, tack. Disinfect thoroughly. Wash your hands constantly, maybe even change clothes between handling sick and healthy horses. The horse's stall needs to be managed carefully too. Good ventilation is key, but minimize dust. Dust irritates already inflamed airways.
So maybe soaking hay?
Exactly. Soaking hay, using steamed hay, or switching to dust-free options like haylage or pelleted feeds can make a big difference. Bedding should also be low dust if possible. And of course, hydration and nutrition are vital. Constant access to fresh, clean water. Maybe offer warm water in cold weather to encourage drinking. Feed needs to be palatable and easy to eat, especially if their throat is sore or they're off their feed. Things like wet mashes, soaked hay cubes, maybe some fresh grass if appropriate. If they're really dehydrated or not eating well, your vet might recommend electrolytes.
What about medications then? Can we give them anything to make them feel better while they rest?
Yes, symptomatic treatment has its place. NSAIDs, non-steroidal anti-inflammatory drugs are commonly used.
Like Banamine or Bute?
Precisely. Flunix and Meglumin, that's Banamine or phenylbutazone, Bute. These help reduce the fever, ease muscle aches and pains, and can really improve the horse's attitude and appetite. They're usually given just as needed during that acute phase when the fever is high and they feel lousy. A word of caution, though. You need to use them judiciously, carefully, especially in horses that aren't eating or drinking well, because NSAIDs can have side effects, particularly on the stomach and kidneys.
Okay, so NSAIDs for fever and aches. What about antibiotics? You mentioned secondary infections.
This is a really critical point. Antibiotics are only for treating or sometimes preventing secondary bacterial infections.
Right.
They do absolutely nothing against the influenza virus itself. Viruses don't respond to antibiotics.
Right. Using them unnecessarily is bad.
It's worse than useless. It contributes to antibiotic resistance, which is a massive global problem in both human and animal medicine. So you only use antibiotics if there are clear signs of a bacterial complication.
Like what kind of signs?
Like if the fever persists or comes back after initially dropping, if that nasal discharge turns thick and yellow or green purulent, if the cough gets worse or sounds wet and productive, or if the vet auscultates the lungs and hears evidence of pneumonia. Ideally, the choice of antibiotic would be based on culturing the bacteria and seeing what it's sensitive to. But often, treatment needs to start sooner, so a broad-spectrum antibiotic might be chosen initially, like penicillin or trimethoprim sulfa, or maybe doxycycline.
And are there any medications that should absolutely be avoided?
Yes, corticosteroids. Drugs like dexamethasone, they should generally not be used in cases of equine influenza.
Why not? They reduce inflammation, right?
They do, but they're also potent immunosuppressants. They dampen the horse's own immune response. And recovery from influenza depends heavily on the horse mounting an effective immune response to clear the virus. So suppressing that is counterproductive and can actually make things worse or prolong the illness.
Okay, that makes sense. So lots of rest, good environment, careful use of NSAIDs, antibiotics only if needed, and no steroids. While the horse is recovering, how closely do you need to watch them?
Monitoring is really key throughout the recovery period. You need to be checking their temperature, ideally twice a day. Keep a close eye on that nasal discharge. Does it change in character or amount? How's their appetite? Are they drinking enough water? What's their general demeanor? Are they brightening up or still lethargic? And regular checkups by the veterinarian, including listening carefully to their lungs, auscultation, are important to catch any developing pneumonia early.
With all that care, what's the usual outcome? What's the prognosis?
For uncomplicated cases, the prognosis is generally very good. Most horses, if they get the appropriate rest and supportive care, make a full recovery within, say, 2 to 3 weeks, although that cough might linger longer. However, the prognosis becomes more guarded, more uncertain if complications develop.
Like the pneumonia or those rare heart issues.
Exactly. Secondary bacterial infections, especially pneumonia, can significantly prolong recovery. Chronic lung damage is a risk if healing isn't complete, and those rare but serious issues like myocarditis or vasculitis carry a much poorer prognosis. In complicated cases, recovery can take months, maybe up to 6 months sometimes, And unfortunately, some horses might be left with persistent respiratory problems or never return to their previous level of athletic performance.
Are some horses more at risk for a poor outcome?
Yes, generally very young horses, like foals up to maybe 5 years old, and geriatric horses tend to be more susceptible to developing severe disease and complications. And it's worth repeating. Vaccinated horses, even if they do get infected, because vaccines aren't always 100% preventative, they typically have much milder symptoms, shed the virus for a shorter time, and have a significantly better prognosis for a full recovery.
Okay, so we've covered what EI is, how it spreads, how to spot it, diagnose it, and treat it. After all that, it feels like the biggest message is about stopping it before it starts.
That's absolutely the take-home message. Prevention is, without a doubt, the most effective strategy against equine influenza. It's where you get the most bang for your buck, effort-wise.
And prevention basically comes down to two main things, right? Biosecurity and vaccination.
Exactly. Those are the twin pillars.
Yeah.
Biosecurity is all about management practices to reduce the risk of exposure. Things like quarantining any new horse arriving on the property, ideally for 2, maybe even 3 weeks before letting them mix with resident horses. That's non-negotiable, really.
Separating new arrivals. Makes sense.
Avoiding sharing equipment between horses, especially things like water buckets, feed tubs, grooming tools. If you must share, disinfect thoroughly between uses. Good hygiene for people handling horses is critical. Wash your hands frequently. Maybe have dedicated boots or coveralls for different areas or groups of horses. When you go to events, shows, trail rides, minimize direct contact between your horse and unfamiliar horses. Avoid shared water sources if possible. And if you do suspect an outbreak on your property, establishing strict quarantine protocols immediately for affected and exposed horses is vital to contain it.
Okay, that's the management side. What about vaccination?
Vaccination is the other crucial component. Regular vaccination helps prepare the horse's immune system to fight off the virus if it does get exposed. It's important to understand, though, that immunity from current flu vaccines tends to be relatively short-lived compared to, say, immunity after natural infection, often providing good protection for maybe 6 to 12 months.
So regular boosters are needed.
Yes. And because of that antigenic drift, we talked about the virus changing over time, it's vital that the vaccines used contain relevant, up-to-date strains. Currently, recommendations are that vaccines should include strains representing both Florida clade 1 and Florida clade 2 lineages of the H3N8 virus. Those are the main ones circulating globally right now.
Are there different types of flu vaccines available?
Yes, there are several types. You have whole inactivated vaccines, often called killed vaccines. There are vaccines using ISCOM adjuvant technology, which helps stimulate the immune response. There are modified live intranasal vaccines, and more recently developed recombinant vaccines, often using a canarypox virus vector to deliver the flu antigens.
So different technologies. Does the vet decide which one?
Exactly. Your veterinarian will recommend the most appropriate type based on your horse's age, health status, risk level, what's required for competition, and what strains are considered the biggest threat in your region.
Speaking of schedules, what are the general guidelines, say, for a foal or just a regular adult horse? And I know competition horses often have stricter rules.
Right. The American Association of Equine Practitioners, the AAEP, provides guidelines. For foals, the schedule depends a bit on the vaccine type and the mare's vaccination status. But generally, using an inactivated vaccine, the primary series often starts around 6 months of age, with a second dose 3 to 4 weeks later, and then a third dose around 10 to 12 months of age. Other vaccine types have slightly different timings. For pregnant mares, giving a booster 4 to 6 weeks before they're due to foal is recommended. This helps increase antibodies in her colostrum, the first milk, which gives the foal some early protection, though intranasal vaccines are usually avoided in late pregnancy.
And for the average adult horse, not competing heavily.
For adult horses considered at lower risk, maybe not traveling much or mixing with many outside horses, a yearly booster is often considered sufficient after the initial primary series.
But competition horses are different.
Yes, absolutely. If you compete, you must check the specific rules of your governing body. They often have very strict requirements. For example, the FEI, the international body, requires a primary course of 2 doses given between 21 and 92 days apart. Then a booster must be given within 7 months of that second dose. And after that, boosters are required every 6 months, with a little wiggle room of 21 days. In the UK, thoroughbred racing has its own specific rules too, slightly different timings.
So the key is Check the rule book for your discipline.
Definitely. Compliance is essential. You can be barred from competing if the vaccinations aren't exactly right according to their schedule.
You mentioned earlier that vaccination doesn't always prevent infection completely. So what's the main benefit then? Why do it?
That's a crucial point to reiterate. While vaccines might not create a perfect shield, they are incredibly effective at reducing the severity of the disease if the horse does get infected. Vaccinated horses typically get much milder signs, maybe a slight fever or cough instead of severe pneumonia. And importantly, they usually shed much less virus and for a shorter period.
Ah, so they're less likely to spread it to others too.
Exactly. So vaccination protects the individual horse and it helps reduce the overall transmission within the horse population. That's herd immunity in action. And interestingly, vaccination can even be a useful tool during an outbreak, especially for boosting the immunity of horses that have been previously vaccinated but might be due for a booster.
Okay, so wrapping this all up then, it seems the key takeaways are equine influenza is out there, it's super contagious, primarily spread through the air but also contact.
Right.
Recognizing the signs, fever, cough, lethargy is important, but diagnosis needs confirmation. Treatment is mainly supportive care. And rest, lots of rest, is absolutely paramount for proper recovery and avoiding long-term issues.
Couldn't emphasize that enough.
And ultimately, the best approach is prevention combining really good biosecurity practices with consistent, up-to-date vaccination according to your horse's risk and any competition rules.
That sums it up perfectly. But maybe a final thought for our listeners to chew on. Given the EIV is constantly undergoing this antigenic drift and horses are moving around the globe more than ever for competitions, breeding, sales, how do you think vaccine strategies might need to evolve in the future? Are we moving towards needing even more adaptable vaccines, maybe universal ones? And what's the role, really, of every single horse owner, every person in the equestrian community, in being vigilant, in monitoring, reporting suspected cases quickly? How vital is that community effort in actually controlling this virus, not just for their own animals, but for everyone?
Those are definitely some provocative and important questions for all of us involved with horses to think about. It really highlights how interconnected equine health is. Thank you so much for walking us through all of that. And thank you, our listeners, for joining us on this deep dive into equine influenza. We hope you feel better equipped to understand and manage this important disease.